Don't forget about Zoom etiquette. Keep your mics off, please, unless you've got the floor. And of course, remember to turn them on. I always get mixed up on that one. Anyway, that said, everybody's received an agenda, courtesy of Mr. Moslin, who is always right on the mark with getting those out to people. So hopefully you've had a chance to review the agenda. We do have a late item, which Mr. Moslin has added to the screen version. That is from Whispers of Hope and regarding the terms of reference. So if that's okay with you, Melissa, we will add that to late items.
Well, thank you. I didn't expect that because I knew the secretary did need to receive it 30 days in advance, but if there's time for it, I think that'd be great.
Okay, thank you. Okay.
Chair, can I just
Yes.
inform the meeting of the regrets that I've heard and some questions about that?
Thanks, Chris.
Sergeant Pebler can't meet us in Zoom. I've heard from Tanis Carson, who has a Wednesday booked. Zena Dorner has let me know. I have heard that more through the grapevine than anything, that Jen Brown with Coins is no longer with Coins. So if anybody here can enlighten us on that.
Hi, as far as I know, that's true. I believe that position is now posted for Aboriginal Health Coordinator for Coins.
Okay, thanks very much, Amanda.
Sure.
Okay, and as the meeting could see, Amanda is here as a guest, as is Lori, and Alex Schuster-Beat of Anchors was invited. Okay, don't see him yet. Anyways.
So, yeah, I haven't seen him yet. Add to that, Chris, that we have a change with the DBA, and
yes,
John Zibin should be joining us in the place of Deborah Baker.
Yes.
I haven't seen Johnny in the waiting room yet, however.
Okay, thank you, Chair, for bringing that up. That was another change.
And we have a Susan Cummings online here as well.
I believe she's a guest of Ann's.
Oh, okay, great, thank you. All right, let's get back to the agenda. We've had the distribution of the agenda through Mr. Moslin. That said, I hope you've all had a chance to look at it. We've added a late item, terms of reference suggestions from Whispers of Hope. That said, can I have someone please move to adopt the agenda? I can't see everyone on my screen, so if you want to just holler at me. Okay, Mr. Moslin moves to adopt. Someone to second, please. I can't see that either. So
Mr. Pratt seconded it.
Thank you, Mr. Pratt. Moving on, we have minutes from the January 20th regular meeting. The meeting was available online as well via Zoom. Has everyone had a chance to review the minutes? I'll take that as a yes. Can I have someone move that the minutes of the January 20th meeting be adopted as read, please?
So moved.
And someone to second? Thanks, Juliana. Seconds. All right. So next on the agenda,
Chair,
we have reports.
Chair, can I interrupt? I'm sorry to interrupt again, but
not at all.
So basically, I've been a little bit. I haven't posted the approved minutes from December yet. It's my oversight more than anything on the website, on the Facebook group page. But I will catch up with these latest approved minutes from January. Just some guidance from the group. Would the group like me to post the terms of reference as well?
I'll speak to that. I think it would be a good idea, Chris, that everyone gets a copy of it, or post them online. You mean? Sorry.
That's what I was suggesting.
Oh yeah. No, I don't think so. I think I would recommend that they be sent to members.
Okay.
And that's probably all we need to do there.
Thank you for the direction.
All right then. Next on the agenda, we have reports, and first on the list is, I guess it would be Darren with regard to the winter shelter at Hardyview.
So shelter ops are continuing. The last 5 days we've been at capacity. So we've been at that 15 mark. Yeah, and just kind of cruising along. We've had some concerns expressed around some variants to the travel corridor. So Shane and I have been having conversations with some folks in community about that. Community needs to understand that those are guidelines. We can't really enforce that. We ask that our residents up at the shelter abide by those travel corridors as a sign of respect and the good neighbor policy. But under the Charter of Rights and Freedoms, you can't dictate where people can and cannot walk. So just that gentle reminder to community. So yeah, that's where we're at with the shelter.
Any questions for Mr. Pratt? Ann Palmer?
Thank you. Yeah, I had some questions from the community. Wondering whether or not it's possible to, I know there's confidentiality issues, but is it possible for a breakdown? Like, are we allowed to know, how many men, how many women, if they're transients or if they're actually members of the, that actually have been living here for a long time? Can you do any kind of a breakdown, Darren, on that?
Not at this time, no.
Okay, and there was another question I had. Oh yeah, the numbers. I know that they probably went up during this cold snap. Are they heading back down now? Are you noticing that?
Well, as I said earlier, Ann, we're sitting at capacity right now. So no, they're not going down.
They're not going down, okay. And when did they actually come up to capacity? Did they come up at Christmas and stay, or because I know they went up at Christmas time, you'd said?
They bounced up at Christmas, they diminished, and then they've been back up again consistently for the last 2 weeks.
2 weeks, okay, super. Let me see if I got anything else here. Oh, that's the other question I had. There's been talk in the community that there's some kind of a motel program going on. Do you know anything about that, or who's running a motel program?
So there was a group of citizens who through December and early January were running an ad hoc motel program. I really don't know the ins and outs of that. That had nothing to do with my agency, so I can't speak to that.
Okay, and you haven't heard anything about who it might have been, or, I mean, it wasn't Red Cross, because originally we had heard Red Cross, but then I don't think that was them.
So when the fires occurred up at the place colloquially known as Dembskieville, the Red Cross did provide shelter vouchers for, I believe it was 6 fire-affected residents of Dembskieville. So that is a provincial mandate. So any of us on this call has a home burned or flooded, the Red Cross has a provincial mandate to provide emergency shelter for that. They did do that through a motel program, and that ended, I believe, they extended it once. So I think those 6 residents had a total of 7 days of shelter provided by the Red Cross, and then that ended. So my understanding is, like I said, this was a group of concerned citizens who stepped forward and made arrangements for not only those residents, but a few others to be housed in a motel.
Super, thanks, Darren.
Any other questions for Mr. Pratt?
Chair, I've got one.
Yeah, Chris, go ahead.
Mr. Darren, have you turned anybody away from the shelter?
So we have not turned anybody away, but we have had a couple of clients who have chosen not to abide by the very clear policies. And so we have had a couple that have been asked to leave temporarily and then return upon their decision to actually kind of comply with the expectations.
Thank you.
Thank you, Mr. Pratt. Any further questions? We'll move on then. I think this might be you as well, Darren. Update on the coldest night of the year activities?
Well, all I know is Councillor Moslin has created a very heated foot race with Rachel Warner, and those 2 teams seem to be really getting after it. So yeah, everything's scheduled to proceed on the 20th. We've been very, very pleased with the community response and all of the support from our partners, especially here at the SAG table. So we're very, very grateful for that. So yeah, we're going Saturday night.
Nice. Questions regarding coldest night of the year?
Chair, if I might just add to that, yeah, this is basically a this is right up my alley as a trails guy too. I think at last count it was 86 people walking in our community in February. 16 teams, 18 teams, I can't quite remember. It is, for me, it's great to see so many people outside. It's a great cause. And if you haven't visited coldestnightoftheyear.org, cnoy.org, do so and take it in. And you also get a glimpse of what's happening across the country, around in the province and across the country as well. So thank you to Boundary Family Services for initiating that.
And I just want to say no offense to anybody who is a group. I supported the city's team because I'm a counselor.
Thanks, Christine. Any further? Lori Trishler. Lori, we don't typically allow questions from the gallery. So I think probably the best way to deal with that is just jot down your questions, and you can forward either via the chat line or talk to us after the meeting. We'll stay on for a few minutes. And if you have any that you would like cleared up. All right, thank you. All right, so that's it for Coldest Night of the Year. Thank you, Darren. Update from Grand Forks seniors, that would be Juliana.
Hi, well, thank you very much. I appreciate that. I just want to preface this by thanking everybody, members of the community council who've helped the Senior Society to this point. Basically, the background information is the Senior Society itself has been in peril since the flooding event, actually, of a few years ago. And now, of course, COVID has kept the society struggling. As you can imagine, the displacement of our seniors has been exhausting. Unable to secure a venue for a definite length of time, our membership has suffered greatly. Key issue here, of course, is that the Grand Forks Senior Society need a center. The purpose of the Senior Society, of course, is to provide a forum for seniors who are residents of Grand Forks and the regional district, and to meet and engage them in various activities. And the Senior Society helps protect the rights and interests of all our seniors. Without a building, we cannot secure grants to maintain operations. So as a senior center, we must leverage resources from a variety of sources. They include grants from businesses, bequests, in-kind donations, what have you. And we've actually had to turn down such grant from a community organization because we have no building. The social impact and not having a seniors center is the social engagement portion of it for the seniors' well-being, and regardless of their age. Yet it's probably most vital during a person's senior years, because older adults and the elderly are sometimes more susceptible to social isolation than younger people. Having an active social life helps prevent depression as well as Alzheimer's and other types of dementia. Intellectual stimulation keeps the mind sharp, and you can learn new knowledge and skills while also having fun at a center. To do that, you need to find social events that interest you, and you need a social club that understands you, and the Grand Forks Senior Society is that to seniors. Now, we tried updating the structure of the Senior Society so that it's transforming the senior center to more of a health and wellness model for the community, not just for all for seniors, but just for members, excuse me, but for all seniors. And in these changing and challenging times, we need to keep our older generation healthy. Senior Center protects older adults against the negative health consequences associated with social isolation. Now, during this pandemic, if we had a building, we could have helped so many more seniors. And senior centers of the 21st century have to be more things and more relevant, I think, despite decades that separate them from the other generations, to all the older generations of all the older adults who they all need opportunities to socialize, volunteer, and improve their health and wellness in the community. Just a further information, we've been looking, just to update you, we have looked at many options. The Slavonic Center, which is now empty, was a possible location, and there's conversation about that. There is the Whole-Way House development, which is in the process of working with the city to build a permanent seniors housing, which would include a senior center, but that also is dependent on grants and what have you. And just to give you an update on the membership, pre-flood, it was 170 members, paid members. The membership now is at 47, and our membership has dropped from $30 a person to $6 per person. And that was to ensure that we could pay the dues that we need to BC so that we can remain a viable society and keep our number, nonprofit organization number. The finances right now for the Senior Society are $11,395 as of December 2020. That's a matter of record, so I just want to be very clear that is all we have in the bank right now. We have the support of council, which we appreciate, and I'm just asking for the support of this group and the community at large and their resources to continue. If we cannot get a seniors center up and running, we'll be forced to close, and our monies are then reverted to the association, and they'll not be inject back into the community. So that 11,000 will be lost to this community. So the recommendations are basically your knowledge, the community partners, advisors, government contacts, responding to social issues in the community is invaluable. So you may know of a place that we can lease or rent. You may have an idea that we have not yet thought of, and your anticipated cooperation, benevolence, and assistance would be appreciated. Need a building with approximately 1,500 square feet, preferably with a kitchenette, but this is what we're looking for. And of course, can't meet at this time, so there is time to, but I say there's time for us to look at it. The truth is, if we just leave it and then the pandemic finishes and everybody gets inoculated, it might be too late by then. So we continue looking, and I should have prefaced this by thanking again everybody that has already helped us, because we do appreciate that. So we just wanted to keep you up to date on exactly what was happening with the Senior Center and how much we need your support and assistance at this time. Thank you very much.
Thank you, Juliana, for a very well-prepared report. Any questions for Juliana? I see Ann Palmer's got a hand up.
Thanks, Juliana. That was very nice. I just, maybe I'm looking for some clarification. Now, I understood that at the end of the flood, there was supposed to have been monies because you lost your building. And I thought I had heard that council or somebody had decided to hold that money in abeyance and not put it towards a building for you guys until thinking that it would go towards the new rec center that we've been talking about doing social. And I understand now that that has been scrapped for at least another year or more because of the COVID. So I'm wondering if council and doesn't have some way of providing something for you guys in the meantime, because, you know, realistically the money was held. Now, if I'm wrong on that, please somebody let me know. Thank you.
Well, thanks, Anne. Yes, of course, the building was insured. Remember, the building belonged to the city. So any insurance monies do belong to the city. City, we have been working with them, and they are trying to help us locate a building. There was a talk of modulars and things like that. It's been slow going, and none of this has come to fruition yet. We are still working with the city and I guess the city staff that were assigned to help us. So nothing's been set, nothing's been lost either, you know, if that answers your question. I know there are council members here, so I don't know if they can elaborate on any of that.
Any further questions? Trying to keep track of everyone here. I've got this
Oh, Tammy has.
pesky window that blocks my view of some of you, so I have to keep moving it to see any. Oh, down at the
Tammy has her
bottom.
hand up.
Tammy, I see you. Thank you. Go ahead.
Juliana, so just for the sake of saving time in this meeting, what's your contact info so that we can share ideas of venues?
Oh, absolutely. Well, I've got my email address. It's on our.
Okay, I'll email you.
Yes, absolutely. Please give me an email. I don't have a problem citing my email here.
Right.
On it, but that's probably the best way to get a hold of me, and then I can contact the board and that with any suggestions you may have.
All right. Any further questions? If I don't notice you, please just yell at me. This Zoom thing's a little bit pesky at times. Okay, I'm not hearing anyone. Given that, I would like to move on to Mr. Moslin, who will update us on the city survey, please.
Okay, thank you, Chair, and I would acquiesce to Councillor Thompson too. Basically, it has come up in our budget discussions. At the last council meeting, council asked to fast forward the survey, the funding for the survey. And I believe that is the further discussions with council, the consultant, Barb Floden, is going to be discussing, reaching out to each councillor, asking them what it is you want to query the community about. And so the survey is still in the works. It is rushed. The hope is that it will be administered sometime in March. But there's still lots to be decided. And I pass the torch over to Councillor Thompson if she wants to add to that.
No, I think you've covered it all. I'll just advise that council is having a budget workshop on the 24th. And that issue will probably, or this funding will probably be brought forward at that time too. But we want to make sure, as I've said before, that the survey does not skew people's answers in one way or the other. We want to make sure that they are formulated, well formulated, as soon as we have any more updates on that, we will certainly be letting everybody know. I hope that helps.
Thank you, Christine. Thank you, Chris. For the benefit of our media presence, Chris, what formally are you titling the survey?
Good question. I don't really have a title off the top of my head. It's a housing survey in the sense of what we're trying to gather is the level of community support for supportive housing more than anything. I think that's it. And we're trying to, gauge that. We have some big decisions ahead. We want to make sure that we've given a whole community a chance to weigh in on it. The survey seemed to be the best way to go. So that is generally what we're about. Anybody, Councillor Thompson, you want to add to that?
No, I think you've answered that. There is no at this point in time particular title of the survey. So as we know more, we will be able to advise the community and this group more as well.
Okay, thank you. Any further questions? I see a hand from Ann Palmer.
Thank you. So is this just strictly supportive housing? What about low income housing? What about things like these laneway houses, garden homes, turning homes into duplexes, basement suites? I mean, I'm thinking it seems a lot to put money into a survey for only one thing.
Christine Thompson.
The laneway homes and the secondary suites, that's already been dealt with through our bylaws. And this survey is specifically on supportive housing. Because as everybody is aware, BC Housing has purchased land to build that. And we made an offer for an exchange that was not accepted by the residents in the area. So in order to move forward, we really need to know what the community, and when I'm talking community, I'm talking, in my opinion, and I think that's the way it's going to be done, is the city of Grand Forks only, because it's our taxpayers that are going to be impacted by whatever decision is made. So although there's been discussion about going out into the rural area, we don't have the authority to approach those residents. So to me, it's and Councillor Wasson can correct me if I'm wrong, it's strictly the Grand Forks residents that are going to be surveyed.
Thank you, Christine. Can you tell me how this is going to be gotten out to the members of the community of Grand Forks? Is this going to be a link, or is it going to be paper? How is it going to be distributed?
I don't think that decision's been finalized yet, Anne. There's been some discussions on the best way to do it, and everybody's got a different idea. But I think once we have the questions formulated, then the determination can be made how to best get it out sooner rather than later.
Thank you.
Very much appreciated. Any further questions? Not seeing any, we'll move forward.
Just
Oh,
one
sorry.
thing on that. We're going ahead as fast as we can. Pretty much all of council wants to see this move forward with some alacrity. And like I said, my hope for timeline was have the survey ready and out to the public in some form in March. We need to have some sort of gauge of community thinking on this ASAP. Thank you.
Thank
Kathy
you.
here. I'm not on Zoom.
Thanks, Kathy. Go ahead.
I wanted to make a comment. This housing survey, the city survey would be about supportive housing. What about transitional housing? That seems to go together. Supportive / transitional housing. Over and out.
Thanks, Kathy.
I think at this time, we're just dealing with supportive housing, not necessarily transition.
Okay, if I'm thinking that if you're talking about the housing for the homeless and, other vulnerable, that they would need a transitional kind of housing before they go into supportive housing. That's my thought.
Kathy, I don't think that's been, and Councillor Mosden, correct me if I'm wrong, I don't think that's been discussed.
Oh, I sort of see the transitional housing after the supportive housing. The other issue in there, of course, is the idea of a year-round shelter. Both a year-round shelter and supportive housing were identified by the regional district's housing needs assessment that has been presented to council and the community. In fact, this group saw the highlights. We brought forward the highlights of that to them. We do want, we want to, you know, there's both brevity and speed are what are of the essence. Time is of the essence with this survey. So keeping it as focused as we can might help us keep the size down and keep the output and input, easy and convenient.
Darren.
So just for clarity, how are you defining supported housing in this question?
Thank you. Council is going to be working with BC Housing, Darren, to supply background information for the survey. My understanding is the background information will come out separate from the survey. This is still sort of in the works with BC Housing, but they are going to, they are going to try to provide the community. I'm not sure how, but sort of like with a newsletter or pamphleteering. I'm not sure what, with the background information that will help define what the need is and what some of the options are. Did I really, I hear what you're saying in that, BC supportive housing isn't just the model that BC Housing is proposing with their building. There are other models for supportive housing. Anyways, and we're hoping that BC Housing will help us clarify exactly what it is we're asking people to give us their input on. And I hope, did I answer your question at all, Darren? Sorry.
Darren?
And if I can follow up to that, I think the concern I have is we need to be cautious because the other thing was identified was the need for semi-supported housing for seniors. So if moving ahead, the way this question is structured, if this closes down conversations around supported housing for seniors or vulnerable women or children, I'm nervous about the framework of how this is perceived in community because supported housing takes many forms for many different populations. So I just want to ensure that there's clarity in the metric and how the question is asked and the identification of what this looks like.
We'll wait for Mr. Moslin to respond further.
Sorry,
Could I
it was a good
share
question.
something?
So I was trying to get it down in the minutes. Yes, no, thank you for the caution. And that, that's why, why you are going to be going back to BC Housing, asking for their support with the survey. And I hear what you're saying about, and of course, Kathy Hutton's question too, about transition housing and the widespread and the entire spectrum of housing. There are definitely some gaps in our community. Anyways, so I hear your caution, Mr. Pratt, and it's noted. Thank you.
Thank you, Mr. Moslin. I see Ann Palmer has a question.
I'm just curious as to whether or not council has spoken and gotten the input from BFs and Darren Pratt, seeing as he's brought up some extremely good points. I'm wondering why you're only dealing with BC Housing.
Well, we're not only dealing with BC Housing, we're right here, right now. And I'm hoping to hear a report from the subcommittee on the campus of care. We're trying to hear from other folks as well, right here in this committee.
I'm referring more to the coaching and the how you're putting together your questions. You seem to say that, unless I misunderstood you, that you're dealing with BC Housing on how to put together this questionnaire. And I'm thinking that Darren came up with some excellent points and probably has a lot that he could offer to this.
Yeah, true. And remember, my point was that BC Housing was going to help us with the background information, not necessarily the questions. anyhow, I'll pass it, the hat along. Or,
I think there's been some very important points brought up with that last question. Thanks, Darren. I see Christine has a hand up.
I was just going to say that you're asking about Boundary Family Services input, and we have had discussions with Boundary Family Services, and we want to hear as well from BC Housing. They are not putting together the survey. We have a consultant, a professional consultant that we're working with to formulate the right questions. So I hope that allays some concerns.
I'm going to break from my role here for a minute because I have a burning question. And that is either Chris or Christine, are there plans to bring the draft version of the survey questions back to this committee before it gets formalized?
I don't believe that's been even discussed.
that hasn't been decided in council, John. We could take your suggestion forward, but remember, the goal, one of our, and it is probably, it might be a good one. I'm certainly trying to write down your suggestions here, because this is one form of input right here, right now. And yes, so, but council will make that decision on how it will run by, what it will do with the drafts. If there, time is of, again, time is of the essence. We certainly, and I invite members of this committee, if you have more thoughts on a survey, and please email them to myself or Christine or all of council by going council@grandforks.ca with whatever comments you have about the survey. Yeah, put it out there, put it up there right now, because, we are going to move forward with this. So like to hear from you.
Okay, thanks, Chris. I see Ann Palmer there.
It just made me think of that old saying, never enough time to do it right, but always enough time to do it over. And I'm thinking that, taking a little extra time and getting it right makes more sense than rushing through it and not getting it right.
Mhm.
Christine?
Yeah, I just wanted to comment at this meeting. I have a question from Lori. Why is the city going forward on this survey when the city doesn't know what exactly it's surveying opinion on? And we are moving forward with the survey. Once we have formulated the questions, it's very important that the community be involved in where we're going and what we're going, what we're asking. We want to do it right. We want to make sure that we have the questions correctly, and it's for the housing, the supportive housing. I'm basing my information based on what I saw when we toured some facilities in Kelowna that were run by the John Howard Society, that is supportive housing. And I was very impressed with what I saw and what I observed. So this is basically, in my opinion, and my opinion only, is why we're going forward with the survey.
Tammy's hand is up.
Okay, thank you. Anyone else?
Tammy's hand is up.
Oh, thank you, Tammy. Go ahead.
This is just a clarification question for Christine. So what I'm hearing is that one part of the survey's purpose would be to properly educate the public on what supportive housing is. I know that in the past, the public came against supportive housing, but maybe didn't know what it was. I know a few of us at this table have come to a new understanding over the last couple of years. So what I heard was that BC Housing will be supplying the backgrounder information. Will that be in print, in video? Will it include links? Curious about that. You might not be able to answer that. And thank you for hiring a consulting agency. I don't feel that this table needs to approve that survey. I feel that we have elected you to govern, and you're hiring somebody who's an expert in that field. And so I'm certain that it will be done to their expertise.
Well, thank you for that, Tammy. And what I will say is that as most people sitting at the table, and BC Housing came in, I guess it was 2 years ago, like a bull in the china shop, and said, this is what we're doing, this is where we're going. And council wasn't even aware of it until it was after the fact. So I think BC Housing has learned from that. I have certainly been outspoken about my opinion on that. And I think they very much want to work with the city and the community to provide the service in a mutually agreeable location, and not just come in and say, this is what we're doing, and this is where it's going to be. So I'm looking forward to working with them so that they can make their recommendations. We can have this back and forth. And as I said, develop the survey properly so that the information we're getting back from the community is going to help council make an informed decision, because that is so important.
Thank you, Christine. Any further questions? Okay, we will move on. I'm assuming that this will come from either Darren or Teresa regarding the COVID vulnerable population situation.
So yeah, COVID outreach continues. There's been a bit of shift in community between different camps. One of the things that was brought to our attention earlier today was a question regarding a relocation of some folks to the old Broadacre site. This was just a query that was brought up in our leadership team meeting this morning. I don't have any confirmation from my outreach team if what that looks like or what that means. But yeah, we're continuing on doing outreach for vulnerable populations through the COVID stuff. And yeah, it's been interesting watching the ebb and flow as people move between properties and riverbanks and through community. But our guys are consistently out there connecting.
All right. Questions then for Mr. Pratt, please. Sorry, tongue-tied. COVID questions. Yes, Tammy?
Darren, just from your own professional viewpoint, do you feel that the outreach that's being done for COVID would have value following COVID?
Oh, so Tam, you and I have talked about this for years, that we've always had a need for street level outreach for our vulnerable population, whether it's around mental health or around housing or any of that. It's been good to kind of have a proof that this is a value added service in our community. It's just really lousy that it had to come through a COVID response as opposed to another way of doing it.
Christine Thompson?
Yeah, I don't know if it's relevant to this meeting, but I just wanted to say that at our last regular meeting of council, a resolution that I put forward that will go to the AKBLG and then subsequently to the UBCM if approved at the AKBLG, is that the provincial government provide more support services. And, it's mental health, addiction is deemed a mental health issue across Canada. So basically, I put this resolution forward so that government put your money where your mouth is. If it's a mental pandemic across Canada, then let's get the resources we need to help these people. So I just wanted you to be aware that was something that was put forward and approved by our council.
Okay, thank you, Christine. Any more questions? Yes, Mr. Pratt.
Mr. Chair, I have my hand up. Mr. Trischler from the Gazette has asked a question of staff. So we have 2 outreach staff, but it rotates. So we have one main lead for outreach, and then we have another. So what we do is we have a few members of our shelter staff who rotate through to provide outreach, but we've got one main outreach worker. And again, but we're always staffed double because of working rural and remote. So there's always 2 at a time.
Thank you. Ann Palmer.
Does anybody know what's happening with Broadacres? I actually drove by there the other day because I was trying to rev up the battery in the car, and there must have been 6, 8 vehicles anyhow parked outside there. I was wondering if something's happening there that we might like to know about.
Like I mentioned earlier, Ann, it was brought to my attention this morning at 10 o'clock by members of my team. So yeah, I'm just as curious as you are.
All right, thank you. Further questions? I don't see any, so that opens it up to any updates from anyone else who's present that wasn't included on the list. Would anyone else have any news for us? Yeah, I'm going to move on. Old business.
Chair, please.
Oh, yes. Sorry, Mr. Moslin.
A question, quick one to Ally. Ally, at the last meeting, you reported that the Boundary Women's Coalition, you're overstretched. Is that still the case?
Yes, it is. We've been very busy. Our outreach services are really busy as well. I think right now our women's outreach worker has an active caseload of about 50. We've been averaging that for the last few months. And our transition house is
Okay.
Further questions?
Yep. Thank you very much, Ally, for that. And I do have another follow-up to Melissa, if she's still there, and asking her about meal preparation and that sort of thing for Whispers. Is that still the same at the same level as it was reported in January? If Melissa is there.
Yes, actually. So January, we were around 41 people per day on average. And for February, we're around 43 per day. So basically the same, if not maybe a little higher. And yeah, still kind of keeping busy and keeping the washroom open, the phone available, and sanitizing regularly. But yeah, folks are really needing access to phones and internet and washrooms because those are quite limited still in town. So yeah.
Okay. Okay, I take it we can move on to old business then, and we have a brief report from Teresa regarding the Campus of Care Action Plan.
Thanks, John. Can you hear me okay?
Yep.
Okay, so we are continuing to compare and contrast the Campus of Care model with supported housing and review the viability of that model for the community. We're also happy to report that Diane O'Brien will be attending on behalf of Interior Health. So we do have an Interior Health rep on our subcommittee now.
Questions for Teresa? Okay, that work continues. So we will move. Sorry, Mr. Moslin, go ahead.
Yeah, I'm glad to hear that you're trying to compare the campus model, which I'm assuming means, I'm not too sure what it means, but I think the intent of the campus of care, one of them is that there would be more than one type of housing available in one location, and that there would be more than one outreach organization involved. So rather than just BCH, it would also include IHA and perhaps other NGOs as well. At the beginning of this, Mr. Pratt and Boundary Family Services felt that the Hardyview Lodge would be an appropriate site for the campus of care. So I guess my question is this still the case?
Well, I think at this point, Councillor Moslin, give me an alternative.
Yeah, I don't have one.
That's not fair.
All right, any more questions for Teresa? I'm going to briefly depart from my role here, and I'm part of the subcommittee as well. And I think it's important that I clarify something, is that we should not lose sight of what the mandate of the subcommittee actually is. The subcommittee was formed through motion by this committee, and its task was specifically to compare and contrast models, as Teresa indicated earlier, looking at comparing what might be a campus of care to the existing model that BC Housing has put on the table. That said, I want to make sure that nobody's under the impression that the work of this committee involves, at this point, the generation of a proposal. We're investigating. And I want to also make clear that the campus of care name description is something that is not really, it's not a familiar term in the world of supportive housing as we're looking at it. The campus of care model is something that originated with seniors housing. And it was something that we kind of adopted. But if we get online and we start searching, for example, for campus of care with relation to vulnerable and high risk populations, we're not going to find anything because there's no other project in the province bearing the same name. Now, Teresa, in the work of the subcommittee, has pointed out that traditionally, in terms of the accepted nomenclature, that such a project is more appropriately termed a therapeutic community. And so we have adopted the title of campus of care, but it's nebulous. It's never been defined in this context before. And so we're leaning towards the idea of calling it a campus of care dash a therapeutic community. So again, I'm just trying to kind of clarify expectations here. We're comparing and contrasting one thing that exists, which is a model currently on the table from BC Housing, to something that doesn't exist, which is basically, when you think about it, more like a wish list, which is ambitious. And we've agreed that we would like to see something that includes full wraparound services, et cetera, but it's certainly far from having been defined in the real world. I wanted to clarify that because I see the term being bandied about on social media and in meetings. And I think the community is kind of developing an expectation that there's this magic bullet out there called a campus of care. We're in fact, we're I guess being creative here and trying to put something new on the table for consideration, but we're a long ways from that. We're still busy trying to define what it is and what it might look like. So I wanted to clarify that just because I think it's very important that we don't build our expectations or the community's expectations around something so nebulous at this point. I hope my intent here is clear. That said, any more comments? All righty then, that puts us on to new business. And we've got a report from Amanda regarding the Grand Forks Community Action Team. So Amanda Erickson.
Hi, everyone. I think I was on a meeting last year, so it's nice to see some of you again. And so my work is as a consultant with Anchors. I also work as a registered clinical counselor, and I'm the facilitator of the local community action team in Grand Forks, in Castlegar, and in Nelson. And so the work started in Nelson with the Nelson Fentanyl Task Force in 2016, right at the time that the overdose crisis was declared. We have our statistics now from the coroner's report that was issued by Lisa Lapointe just recently for our 2020 statistics. The death report for British Columbia for overdose is 1,716 people, as you may have seen in the media. So, sadly, this is the worst year ever in terms of overdose deaths. So for our region, the Kootenay Boundary region, we have 19 people who have died by overdose. So I wanted to share that with you first of all. Lisa Lapointe, when she speaks to it, her address is very moving. She says people are dying in communities all over BC from all walks of life and leaving behind brokenhearted families, friends, and colleagues. So illicit fentanyl is responsible for 86.8% of the deaths in 2020. About 80% of those dying are men between the age of 19 and 59. She says, let's change our approach from one of punishing and blaming to one of supporting and healing. Let's help. So her findings recommend four sections to continue. See, last year in 2019, we were down to 943 deaths for the province. So you can see how much more we have this year with the heavy intersection of the pandemic and the isolation and increasing mental health issues throughout BC and our entire country. And so that intersection, along with substance use, is partly responsible. But we have been making some progress provincially until this year. And so going off that, the coroner, she says, continue harm reduction practices, including naloxone, overdose prevention sites, drug checking, that it's essential to have access to safe supply through a doctor or nurse. So that would include opiate agonist therapy, to regulate access to treatment and recovery with evidence-based treatment facilities available, and also to end criminalization and reduce stigma. And so the work continues, throughout the Kootenay Boundary with these community action teams. There's 35 throughout the province currently. And with this work, we have an opportunity to bring awareness around some of the gaps within the healthcare system, anyone who may be not accessing services, and to point towards underutilization of healthcare, and to really advocate for increased mental health services and addiction services within the Kootenai boundary, so that, you know, for you guys is Grand Forks and the Greater Boundary region. And then just to share as well that, you know, there is the Kootenai Boundary Supported Recovery Program. So this is mainly for individuals who have attended a treatment program, or they're ready to have community support. And so people can apply from Nelson, Castlegar, and Trail regions, including Grand Forks. There's 8 beds available, and people can stay for up to 6 months. The program's full at the moment, but if anyone wants to join, they can contact Fiona Job, who is the new mental health and substance use clinician, as she moved over from the day treatment program at Castlegar, and now she's filling that role there as a clinician with that program. And you can contact her at Nelson Mental Health to proceed with that intake process. And so that's a very good program. There's lots of life skills development in that program, as well as the clinical counseling offered. And as well, a new thing for the region in terms of mental health and substance use is that we have some new full-time positions, FTEs, offered at mental health and substance use locations for full-time opioid agonist nurses. So that's going to be a great boon for people who are seeking support and care. And for this group, if there is a need for some kind of info session from Anchors, there's a new educator. Her name's Dakota May. And so let me know. I could help to, you know, arrange her to attend your meeting sometime. And so I'd just like to say thanks to the Grand Forks community for allowing me to facilitate the work over the last year or so. And, you know, especially thanks for everyone on the front lines who supports people in your community.
Thank you, Amanda. Any questions? Mr. Moslin.
Yeah, thank you. Yeah, and thank you very much, Amanda, for coming forward today to our meeting. I guess my question is about the Kootenai Boundary Treatment Program. This is 8 beds. It's in Nelson.
Yeah, so it's called the Kootenai Boundary Supported Recovery Program.
Okay.
Yeah. Mm-hmm.
8 beds. And
yeah.
How are those beds housed? Is there a separate building? Are they in a residential area?
Yeah, they're in a residential area in Nelson, and I think I've heard that they're actually looking for a new location at this time as well, and they're doing some expansion of their program as well. So yeah. It's kind of like with a women's center and the transition home. As far as I know, you know, these locations are often kept private for the safety of the clients who are accessing services.
Thank you.
Yes.
Any other questions?
Tammy has a question.
Hey, Tammy.
Thank you, Amanda. Great information there. I wondered if you've noted a difference in stigma in the Grand Forks area since you began your work here. I asked because I was out visiting businesses to update first aid kits for, I go out on Mondays with Diane O'Brien from Mental Health, and we tend to go to camps typically or to businesses and just check in, see if people need training on Narcan kits, etc. Anyhow, when we went out yesterday, we found a remarkable improvement in people's attitudes. And so I had wondered if you found the same thing, or if you feel like stigma is still a real challenge.
Yeah, well, that's great to hear, Tammy, and thanks for the work you're doing. So as everyone knows, naloxone is so key and critical to reversing an opioid overdose. Of course, a lot of the drugs circulating right now also include benzodiazepines. So the breathing is also very key to keeping people alive before emergency services can respond. Speaking to stigma within all our communities and the region, Tammy, that's a part of the work of the community action team. My approach with this work is that I strongly feel that education for everyone within our community, starting with the youth, which has been a focus of mine over my career, working with high-risk youth within mental health. The education can be the key really to stigma reduction. These issues around addiction and mental health, mental wellness, can be very difficult and challenging issues to speak to within communities, within families. And so for that reason, the more that we can share information around, where are our services located in the community, encouraging people to speak out and to come forward when they're struggling, whether that's with anxiety or depression, or they're noticing that they're having more of a reliance on alcohol or substances. This is, very preventative to ensure mental wellness, and so that this is really how I approach the work of reducing stigma in communities. Is the best way to do that is through provision of education. I hope that answers your question. In terms of evaluation of levels of stigma within the community, that's something that is really an ongoing evaluation, and we know that there is a great deal of underutilization of healthcare within our region, and so some of that can be attributed, of course, to stigma, or to people's fear of judgment of coming forward to ask for the help that they might need.
Thank you, Amanda, and thanks for your report. And
Looks
Paul?
like there's a question here.
Yeah, I was just curious, like, are you the group that supplies all the Narcan kits to this area?
I'm not sure. I believe Narcan's available through mental health and substance use in your community, and then there are some outreach providers through I believe it's Boundary Family Services outreach that might also support provision of naloxone. Darren, please correct me if I'm getting that wrong. So my group is made up of a group of stakeholders from the community, including interior health, emergency responders, community, and other social service providers like Freedom Quest Youth Services. And so we look for gaps within, provision of service to people, and also work towards that education piece.
Got one more question on that then.
Sure.
You had the numbers of deaths. Do you have an idea of how many people would have died if they hadn't had the use of a Narcan kit?
Yeah, that's a great question, Anne. And there have been some numbers, brought forward last year. Last year the province was able to, with a combination of some of these harm reduction efforts and all sorts of efforts from our front line throughout the province to reduce the deaths to that 943. And so, there was a number quoted at the time. They said something like, without the harm reduction efforts, there would have been like 3,000 more people who would have died. But I believe that was, from 2016. And so that's, not a direct causal number, right? It's more like a projected attribution that, now more people understand what naloxone is. It's less scary. It's less of a weird thing to know about. And so with more and more people caring, for their friends and family, then, yeah. And so that's one thing, and if yourself or this group is interested, like I say, there's a new educator who's come on board at Anchors as the last one left his position. And so that's something, of course, that if you guys would like to book her in, I could help to arrange that.
Thank you very much.
Sure.
Thank you, Amanda.
Yes.
Any more questions? All right, I guess we can move along. I guess this goes to Darren regarding the scheduled closure of the emergency winter shelter.
So at this point, as per the temporary use permit that the city issued, we can extend past March 31st for 2 weeks, weather dependent. So we're kind of keeping an eye on the weather right now to see if we should make that application to the city for that extension to April 15th. So yeah, it's kind of based on the increase that we've seen, we definitely have a real, in our mind, a justification if we're running at capacity right now to keep it extended through to that March or to that April 15th. So we're likely to bring that forward to City Council in the next week or two.
Any other questions? Thank you once again, Mr. Pratt. We have a late item on the agenda, and that goes back to the terms of reference. We had a brief discussion at the last meeting regarding this. I believe Melissa had some concerns regarding the communications piece. We do, as Melissa herself mentioned earlier, we do, however, have within the terms of reference a stipulation that any changes to the terms of reference be brought 30 days in advance to the chair of the committee. I haven't seen the suggested changes yet, but that's not to say that I'm not open to hearing about it today. And so I'm going to suggest that we hear from Melissa on what she's proposing, and then somebody make a motion, please, to table it for a decision at the next meeting. So I'll turn it over to you, Melissa, please.
Well, thank you so much. And just bear with me. I've got a lot of background noise here. I'm curious, actually, Chris, if you are able to pull up the document that I sent to you.
Okay, will take me just a second. Okay, thank you.
Okay, no worries. I think that might be a bit easier if I read off it and then people can also see. I know I'm not a very good audio or auditory learner, so might help.
Gee whiz. Sorry, Chair, I don't have it at hand. Sorry, Chair, I don't have it at hand.
Okay.
If Melissa, why don't you go on and start speaking to it?
Okay.
And I will I will dig it up and put it on when I have it. Okay.
No problem. So what I tried to do was just kind of go through our emails in addition to our minutes and see if there were points, whether it be points of order or comments or motions that were either made or suggested that didn't make it into the terms of reference just to see if that kind of covered our needs. And then I also included a couple points of a code of conduct. And I know we have kind of tabled the idea of discussing code of conduct until we're, you know, in person a bit more. But I thought that just a basic guideline might help us. So I've suggested a couple points. Firstly, well, pretty much most of these are just in additions to what was already there. So under the advisory chair, I'm suggesting we include that the chair will act as an official spokesperson unless another individual is appointed by the group, that spokespersons will be responsible for addressing and answering questions from the media and the public, and that members may share or quote approved meeting minutes, but should otherwise forward concerns or questions to the spokesperson. I also noticed that there wasn't a section really defining the advisory secretary. And I know that seems really, I don't know, basic, but I thought maybe I would include a brief description there as well. So this position may be filled voluntarily or through nomination from the group and may change as needed to fulfill the duties. The secretary shall be responsible for all note-taking at meetings, gathering contact information of members and participants, and reporting to the group. It is also the responsibility of the secretary to ensure information is accurate, timely, and made available to the public once approved. And of course, we already do have a section about group reporting, and I'll mention that at the end. In terms of adding to the advisory group meetings section, I suggested perhaps including the comment about the recognition statement, as that was something made clear that we really want to ensure is incorporated regardless of who's chairing or what changes moving forward. So just thought I'd specify. Members are expected to attend all meetings or notify the secretary in advance if they cannot attend. Members may invite the public to attend by sharing meeting details and confirming their information with the secretary in advance of the meeting. The public will sit in the gallery and may not speak or ask questions. People wishing to address the table should notify the chair and or secretary in advance to see when or if it is appropriate to add to the agenda. All participants must conduct themselves respectfully and use inclusive language. I wanted to.
Oh, you've cut out, Melissa.
Sorry, folks, I just got a phone call. I wanted to ensure the use of inclusive language, as that was something that came up last year, and Sergeant Pepler had shared that document about words matter. And so I thought just a kind of a mention to it without getting into detail. And then a reminder that in-camera portions of the meeting are considered confidential, and anyone who is not a member must leave the meeting before business can resume. I will ask for clarity around people who are non-members, and if they want to speak, how they should do so. But that was my gist of it, so we can change that. In terms of the conduct, members will involve themselves actively in the work of the advisory group, attend regularly, and accept their fair share of responsibilities, including service on committees or working groups. Members will strive to work as a team and seek to develop effective working relationships with relevant agencies and the community. Members will observe confidentiality when required and exercise with the greatest prudence if a discussion of potentially contentious issues affecting social services arise. Quite wordy, but a lot of these, pretty much all of these, I got from other examples and templates, so we can wordsmith this if we think it needs to be more clear. I just thought it was a good broad statement. And then lastly, the advisory group will encourage the open expression of views at meetings, but accept collective responsibility for all decisions made by the group and its members. This means that members will not speak out against majority decisions in public or private outside of the advisory group. And lastly, just something I wanted to see included under our section to do with the advisory group reporting was really just naming the social or the Facebook group, because I know I'm silly and it took me a little while to dig and find where everything was. So if not the link, like I said, maybe just the full name so it's easy to find. And yeah, I hoped that this wasn't, you know, too contentious in itself and made sense and just kind of better defined things. So this is my suggestion for the group.
Okay, thank you, Melissa. Chris, if I can ask you to take your, thank you. Thanks for taking that down. All right, so I'm going to have to rule as chair here on this. Melissa, I'm going to go with my initial suggestion. Thank you for bringing this to the table. There's a lot for everyone to consider. And I have to say that I'm a little bit disappointed that the working committee didn't get these suggestions when the task was at hand, because we had set, pretty close to a 3-month window to get this work done. And now it comes to us as an amendment to the terms of reference. Now, within the present terms of reference, we also have provision for an annual review. So what I'm going to suggest is that as a measure of good faith, that we respect the 30-day submission deadline, and that we bring this back to the table as old business for the next meeting for some discussion. And we'll see where the discussion takes us at that point in time, whether or not the table will decide to amend or alter or edit and amend at the next meeting, or table it till the next review. That would be a decision for the committee. So thanks for unpacking this for us now. I think it gives everyone something to think about. I would hope that everybody on the committee could be provided with a copy of this one way or another for consideration, because there's a lot there. And so I would like to ask the committee for somebody to move that we table this discussion until the next meeting. Okay, Juliana, so moves. Somebody second, please.
Kathy Hutton?
Kathy, thank you. All in favor?
Yes.
Any opposed? Tammy? Okay, that's carried. Thank you. I see one vote in opposition. Do you want that on the record, Tammy? Okay, for the record, please. Okay, that said, this item will be tabled until the next meeting and included as old business, and we will discuss it at that point. Given that, any other items, additional items? Okay, that puts us at that place where we can, Chris has got this open-ended next steps item on the agenda. So any suggestions for next steps?
My question is the Campus of Care Action Committee going to meet again between now and the next meeting? Is that a next step?
I would think so, Chris. Yes.
Any others? Are there any other suggestions for next steps? The coldest night of the year, of course, is February 20th. That event is up. Hope you all participate. Anybody else got a suggestion?
Tammy?
I don't have a suggestion, but I might have one after my question is answered. So this question would be for our city councilors. Where are we at in the zoning reviews in regards to social services? I was rewatching some of the council meetings from a while back, and one of the challenges that had come up is that zoning needed to be reviewed because it was outdated and didn't include any zoning for social services, shelters, etc. And so I just wondered where you guys were at on that.
I'll take a stab at that. You know, it is at the beginning of term. My intent was to tinker with the zoning bylaw, change definitions, nudge it here, nudge it there. Staff basically spoke up and said, no, we need a much larger revision. And therefore we need to move towards revising our official community plan, which is on the books for happening this year, at least getting started this year. That will be quite a process. And it may not even end in this term. Ugh, I can hope it does, but I don't know for sure. I know it can be a long process. Anyhow, simultaneous and near the end of that, we'll be coming forward with revisions to the zoning bylaw.
Mm-hmm.
Having said that, it's not impossible to make changes to the zoning bylaw prior to a new official community plan being put in place. Anyhow, it is a process that we are moving on. Tammy, thank you for your question. We certainly are cognizant of the need to update our zoning bylaw. It's not just supportive housing that needs to be revision, right down to there's no such thing as modular homes compared to in our current zoning bylaw. And in other words, it desperately needs some updating in several key areas that will impact the community.
So the reason for my question is I know that Darren had mentioned they would be before City Council again to see about extending their service time dependent upon weather. And so I'm seeing where social service agencies need to go before council. That's a block of time that council has to devote to it. If we are going to advise as a table, then that's a block of time we devote to it. And so when these zoning pieces have been reviewed and are done, then there's a whole bunch of time that we all gain. And so I was just hoping to get a feel for that. So
I would just like to say also that when there's a couple of things. When a zoning bylaw is amended, the OCP has to be amended as well. So they go hand in hand.
Okay.
And our staff have tried to speed up the process before it goes to public hearing, any changes to the bylaws. But I mean, if there were an issue for social services housing, so, social housing, then council can deal with that with an amendment to the zoning bylaw and the OCP affecting that one particular piece of property until and unless we get the whole thing done. And that's a lengthy, very lengthy process.
Mm-hmm.
So at the moment, we are just trying to deal with each request as it comes forward. So I hope that answers your question.
It does, Christine. It also helps me have a better understanding. In the time that I've lived here, most of the presentations I've viewed have been social service agencies before the council asking for whatever it is their needs are. And so it gets a different optic than it deserves. And so understanding that there's a process in place and that there's some bylaws being reviewed helps me understand why these people have to come before you so often. So thank you for the clarification. When you say lengthy process, do you mean like 3 years, 4 years, 5 years? Do you know?
Oh God, I hope not. To do it right, I'm going to suggest it could take as long as a year.
Okay.
Okay.
That helps enormously. Thank you.
You're welcome.
All right. Anyone else have any suggestions for the next steps? Seeing no hands, I would like to ask somebody move that the meeting be adjourned and notify you that the next meeting will be March 17th. via Zoom, same time. Mr. Moslin has his hand up.
Does that date work, Chair? I know, I'm not too sure. I wasn't too sure when I suggested that date, if that was going to come in spring break or what the story was.
I think it's the beginning of spring break, but is anyone here affected by spring break?
No.
Okay.
So everyone's okay with March 17th? I see no objections. All right, that puts us at that magical place where we can ask for a motion to adjourn. Ann Palmer, second. Mr. Moslin, any opposed? I would hope not. Thank you, everyone. We will see you next meeting. Christine Thompson will be your interim chair.
Thank you. Thank you for
Sayonara.
sharing.
Thank you,
Thanks,
everybody.
everybody.